Module Overview. Module 4 is dedicated to the intricate, multifaceted, and often complex stage of policy implementation, the critical phase where policies transition from decisions on paper into tangible actions that affect society. This module offers an exhaustive examination of the implementation process, its theoretical underpinnings, practical challenges, and the pivotal roles played by institutions and actors involved. Recognizing that policy implementation is often where well-crafted policies falter or succeed, the module investigates the factors influencing implementation outcomes, including institutional capacity, interorganizational coordination, resource availability, bureaucratic behavior, and external environmental influences. 1. Understanding policy implementation. Definition: the process of translating policy decisions into operational programs and services. Significance: the success of any public policy largely depends on the effectiveness of its implementation. Key components: objective clarity, resource allocation, organizational structures, procedural guidelines, and human capital. 2. Implementation theories and frameworks. Top-down approach emphasizes clear directives from central authorities and strict adherence to policy design. Focuses on hierarchical control, formal rules, and monitoring. Bottom-up approach stresses the role of street-level bureaucrats and local actors who interpret and adapt policies during delivery. Values flexibility, discretion, and frontline innovation. Hybrid and network approaches recognize the complex interdependence between various actors and organizations, promoting collaboration and coordination. Pressman and Wildavsky's model analyzes the complexity of implementation and the importance of sequential steps and interagency cooperation. 3 factors influencing policy implementation. Clarity of policy objectives. Ambiguity can lead to inconsistent actions, resources and capacity. Adequate funding, staffing, technology, and infrastructure are vital. Inter-organizational coordination. Cooperation among multiple agencies and levels of government, bureaucratic behavior, motivation, resistance, or innovation among civil servants. Political environment, support or opposition from political actors and interest groups. External environment, economic conditions, social attitudes, and technological changes. 4 challenges in implementation. Implementation gaps, discrepancies between intended policies and actual outcomes. Conflicting mandates, overlapping authority can cause confusion. Resource constraints, insufficient funding and personnel. Resistance to change, cultural and institutional inertia. Communication breakdowns, poor flow of information among stakeholders. 5 strategies for effective implementation. Clear communication, articulating objectives and procedures to all actors. Capacity building, training and development for implementers. Stakeholder engagement, involving beneficiaries, partners, and interest groups. Monitoring and evaluation, continuous feedback and adjustment mechanisms. Leadership and political support, champions and advocates who drive implementation. Adaptive management, flexibility to respond to changing circumstances. 6 institutional roles in implementation. Central government agencies provide leadership, coordination, and oversight. Local governments, often responsible for frontline delivery. Non-governmental organizations, partners in service provision and advocacy. Private sector, collaborators through contracts and partnerships. Citizens and civil society.